Hi, everyone. This is Samuel Collins, your coding and billing expert for the American Acupuncture Council and the American Acupuncture Council Insurance Information Network and seminars. Today's topic is medical necessity. How do we define it? How do we make sure that we're accomplishing it? And how does it make sure that our claims get paid? And I think medical necessity in this way helps to establish how good acupuncture is and will get us more into the system. For instance, we're now into VA and we hope soon to be into Medicare. How do we do that? By demonstrating that your care works. And I want to give some tools, but also some tips of understanding of what is the meaning and definition of medical necessity. Let's take a look at some slides. The first thing, of course, is always be compliant and have compliance or standards. By listening to these programs to the point, I think this is going to allow you to have a better compliant practice, particularly for my sections when it comes to coding, billing, medical necessity, documentation, you name it. So whenever you think of compliance, always tune in to the point. That being said, let's talk about medical necessity and the law and the legal definition. Medical necessity is a legal concept which refers to a healthcare services or products provided by a physician to a patient. It is provided for the purpose of preventing, diagnosing, treating an injury or disease in accordance with generally accepted standards of medical practice. So that's the legal definition, but really, how do we see it for insurance purposes? Well, let's start with the first one for Medicare. Now, Medicare, of course, doesn't cover acupuncture, but I think it's too important to understand their definition of medical necessity, as often most insurers will follow Medicare. And it says, services or supplies that are needed for the diagnosis or treatment of your medical condition and meet accepted standards of medical practice. Now, when you read that, you still kind of go, okay, well, meet medical practice. What does it really mean? Well, there's beyond even Medicare. Let's talk about how a state might define it. So this is just California. I just picked one at random here. This is how they define medical necessity in the state law. A service is medically necessary or medical necessity when it is reasonable and necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain. Now that, of course, is a very broad scope of definition. I think it's one that we all understand. Medical necessity is that your care is helping to make the patient better. And that's really what I want to emphasize. So let's first kind of get into how an insurance sees it. It means healthcare services are exercising prudent clinical judgment to provide to a patient, and they must be for the purpose of evaluating, diagnosing, treating an illness or injury. Of course, in accordance with generally accepted standards. Now, again, this is where for acupuncture, we have to do a better job of making sure we show there's a standard, but also that it's accepted and working. And that's really the issue for me for medical necessity. It's clinically appropriate in types of type, frequency, extent, site, and duration, and considered effective. And that's the part I think that allows acupuncturists, because of the increase in insurance billing, it's beginning to demonstrate how effective acupuncture is because we're seeing it more. So in actuality, the importance of acupuncture and insurance is that the more that it is used, the better we can evaluate the effectiveness. It's not primarily, of course, for the convenience of the patient. It's not a feel-good or palliative care. In that sense, be careful there's no prevention per se, and not more costly than an alternative service or sequence of services that is least likely to produce an equivalent therapeutic effect. Now, this is where I think acupuncture really can take hold. Certainly, acupuncture can be far less expensive in the terms of physical money, but the cost of life when you consider opioids. So our job is really to make sure that we're always demonstrating it in a consistent manner. So let's take a look at what Aetna. Aetna is a big insurer and does cover acupuncture pretty well, but does have some limited benefits for the type of diagnosis. But here's what Aetna says. If no clinical benefit is appreciated after 4 weeks of acupuncture, then the treatment plan should be reevaluated. Further acupuncture treatment is not considered medically necessary if the member does not demonstrate meaningful improvement in the symptoms. Now, this is a part I really want to make sure meaningful. A patient stating they feel a little better is not really meaningful. We want to have something beyond that. So let's get more into what that really means. And I think Cigna helps define that. They define medical necessity by improvement over a clearly defined period of time. Therapeutic goals are functionally oriented, realistic, measurable, and evidence-based. And this is the part I will emphasize for us. Make sure that we can have something we can measure, something that we can compare over time. And certainly evidence-based means that it shows that it has worked in the past. We want a date of release or discharge. So you never want to just leave it open-ended, like I'm going to treat them forever, but some period of time where you think it's going to be effective. And possibly at that point, maybe it might reach a point of supportive care, but make sure that there is a defined amount. You can't just say, I'm not sure. Give your best estimate. And then, of course, it says functional outcome measures, when used, demonstrate minimal clinical minimal clinically important improvement. Now, here's what I want to make sure. You've got to use some type of outcomes in the office because it's the one way of quantifying what's going on. So there should be some type of baseline and periodic reassessments, and documentation substantiates the diagnosis that we can say, yes, this is getting better, demonstrate a progression towards home or self-care. At some point, the patient hopefully should be doing some things to help themselves, certainly, whether it's home exercise or just, for that matter, meditation. And that, of course, maximum therapeutic benefit has not been achieved. Now, again, these are very broad statements from an insurance company showing that they want the patient better. What I want to emphasize, though, is here is where it talks about measurable, realistic, meaning something we can see. So let's take a look. This is actually from the Cigna guideline for acupuncture. And you'll notice here it talks about standardized tests and measures. It says measuring outcomes is an important component of an acupuncturist practice. Outcome measures are important in direct management of individual patient care for the opportunity they provide the profession in collectively comparing care and determining effectiveness. For me, this is the bread and butter. I know acupuncture works well, and so do you. But can we or have we demonstrated it in a way that we can compare it with other types of care? So it goes on to the second paragraph to say the use of standardized tests and measures early in an episode of care establishes a baseline. Then we go to the second sentence. Outcome measures, along with standardized tests and measures used throughout the episode of care, provide information on predicted outcomes. In other words, it's simply a way of measuring. So here's what I want to highlight, and I've done it in yellow. Standardized outcome measures provide a common language to which to evaluate the success of interventions, thereby providing a basis for comparing outcomes related to different intervention approaches. Measuring outcomes of care with relevant components of function, activity, and participation among patients with the same diagnosis is the foundation of determining which intervention approaches compromise best clinical practice. This is where I think acupuncturists, we can be better in our profession and making sure we're demonstrating that not just by the patient coming in, but what we document. So let's take a look at another insurance. That's Cigna. Here's one through the company eviCore, which oversees a lot of the claims that go through Blue Cross Blue Shield, as well as United Healthcare. And notice it says functional assessment. Documentation of a patient's level of function is an important aspect of patient care. Documentation is required in order to establish medical necessity. And again, it goes on to say the same things. We want something reliable, peer-reviewed. So if you're used to hearing about things like a pain scale or a Oswestry disability or low back disability, neck disability, headache scales, I'm going to implore you to start implementing these, particularly for patients with chronic pain you're going to see over time. So eviCore, though, that one I just showed you is for back pain, but I want to show here eviCore will cover menopausal issues such as hot flashes and insomnia. But notice what they say, functional assessment. Daily diaries are recommended for assessment of hot flashes and night sweats. In other words, the patient came in and they were having night sweats every single day. But after 2 weeks of care, they're having them over only every 2 to 3 days. That's meaningful improvement. In addition, the Pittsburgh Sleep Quality Index is used. That way, you're always measuring. It's not just an issue of saying the patient feels better, but we're demonstrating something clinically and measurable. Now, of course, many of you are familiar with the veterans programs, the PC3, Patient-Centered Community Care, or Veterans Choice. And under that plan, here's what it says: significant durable pain intensity decrease. So that would be the first thing I'd say always to do. Make sure you're indicating some type of pain decrease on the standard 0 to 10 pain scale. I would be careful, though, because at some point, what really is the difference between a 7 and a 6? So focus in. When a patient says their pain is a 7, tell me what they cannot do when it's a 7. That way, when it's a 6 or a 5, we now indicate, well, what can you do? So always attach the pain to a function, not just pain among itself, because certainly you've had a person with a level of 10, but yet they have full range of motion. That clearly is not a 10. Where other patients have very limited range of motion and say it's a 4. So focus more on the pain, but certainly the pain level is important. Do note most insurances, if a patient's pain level is below 3, they consider the patient essentially recovered. The other thing that they state in the VA choice is functional improvement by clinically meaningful improvement on validated disease-specific outcomes. Here's where I'm pointing this out. Notice the common theme among all of them. Functional change, not just pain. So the other factor that helps you, though, and this is something acupuncturist does very well, decrease utilization of pain-related medications. Of course, this is the whole point of the Veterans Choice Program, is patients, of course, with the opioid crisis are in a crisis because that medication eventually is causing many other problems. So anything you can document about frequency, amount of medication, that is going to be helpful in demonstrating that your care is effective. And it says for continued visits, objective measures demonstrating the extent of meaningful clinical improvement. So at the end of the day, we have to measure it. So here's one way of doing so. This is the Defense Department and Veterans Pain Rating Scale. And what I'll highlight here, this is pretty similar to what you're all used to, but I'm going to focus here. Notice a 5 doesn't say how much it hurts. It indicates interrupts some activities. So this scale is not so much about how much it hurts, but the function. Now, I'll give a quick plug. If you have the American Acupuncture Council digital coding or AcuCode, or you've been to our seminars, of course, you've seen this document, but certainly notice it's a pain scale that focuses on function, not just the level of pain. So certainly this is going to help demonstrate the effectiveness because we're doing both pain scale and function. You may also use something like this one. This is called a general pain index. And you'll notice this is a standard 6 question. And notice these questions say family and home responsibilities, recreation, social. But notice it's not how much it hurts, but it says function. If they have good function, it's a 0. Unable to function is a 10. And what we're doing is taking 6 levels of their life and attaching the function. We do this at the beginning of care. And then as the patient progresses, maybe every 2 weeks or so, redo this, showing the patient's improving. Notice at the very bottom right, it says benchmark 5. All that simply means is that the patient has to move at least 5 points to be considered significant. What I think most acupuncturists will find, when a patient first does this, they may well score in the 50s. After even just a week or 2 of care, they're probably going to score in the 40s and drop precipitously at the beginning. And then towards the end, it gets a little bit slower. But so long as we're showing meaningful improvement of at least 5 points, it indicates the care is helpful. At the end of the day, acupuncture works. Are we demonstrating it effectively enough to make sure that we're going to get paid, but also continue the way that acupuncture now is becoming part of the norm in healthcare because they're realizing the effectiveness. Ultimately, medical necessity means show me your patient is better. Don't tell me, show me, measure it, give me something functional. Thank you for spending some time. Of course, take a look. We're on Instagram, Facebook, and Twitter. Look for the American Acupuncture Council, specifically network. Follow us there. You can get all the updates for upcoming seminars and other programs that we do. And of course, take a look at the AcuCode as well. I appreciate your time. And don't forget, tune in next week. And I wish you all the best.